Welcome back to the Woman Factor. Breast cancer is cancer that forms in the cells of the breast, and according to the American Cancer Society, there will be an estimated 252,000 new breast cancer cases diagnosed and 40,000 deaths in the U.S. After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. Breast cancer can occur in both men and women, but it's far more common in women. Significant support for breast cancer awareness and research funding has helped improve the screening and diagnosis and advances in the treatment of breast cancer. Breast cancer survival rates have increased, and the number of deaths steadily has been declining, which is largely due to a number of factors such as earlier detection, a new personalized approach to treatment, and a better understanding of the disease. Joining me tonight is to give an overview of the disease is Dr. Genevieve Maronge, oncologist at Mary Bird Perkins TGMC Cancer Center. Welcome to the show, Dr. Genevieve. We're glad to have you. Yes.
Thank you. Happy to be here.
Yes. So first, introduce yourself to the viewers.
Well, my name is Genevieve Maronge. I'm a hematologist and medical oncologist at Mary Bird Perkins.
Mm-hmm. So how does breast cancer form?
So we're not really sure how breast cancer forms. We know that there's a change in the breast cell, which would be a mutation in the DNA that causes a breast cell to become a cancer cell. That can form a tumor, and that can spread into the lymph nodes and throughout the body. Breast cancer most often begins in the cells that make the milk or the cells that carry the milk, so that's the ducts and the lobules. Researchers have identified that there are a number of factors that may contribute to the risk of breast cancer. That includes environmental, hormonal, and lifestyle factors, but we really don't know why there are some women with considered a low risk of breast cancer and they still develop cancer, and women that are considered a high risk may not develop cancer through their lifetime. Mm-hmm. So that's why it's so important for every woman to have a mammogram for screening.
Right. Now, so essentially it's not clear what causes breast cancer, correct?
Correct.
Okay. Now what are the symptoms of breast cancer?
So the most important thing is that most breast cancer will not cause a symptom. So that's another good reason to get a mammogram and early detection and diagnose early. Symptoms that can develop include any kind of change to the breast, really. So if you develop a lump in the breast, of course, that's significant. Any change to the skin, that could be a redness to the skin, a rash that's not improving, a dimpling to the skin, a change in the nipple, maybe an inversion of the nipple or a change in the skin around the nipple. So really any change to the breast is significant.
Mm-hmm. Now, when should someone see a doctor?
So really, if there's any change in the breast, like you find a lump or a change that's just not improving, you should present to your doctor. And that includes even if you've had a mammogram recently, you can still develop breast cancer in between screening mammograms.
Mm-hmm. And, what are common treatment options of breast cancer?
So there's really a lot of treatment options for breast cancer, and so this is a plan that you make with your doctor dependent on different factors. That includes the size of a breast tumor, it includes the stage, it includes receptors that may be on your breast cancer. So most women undergo surgery as a part of their cancer treatment plan. That may include chemotherapy before or after surgery. That can include radiation. And it can also include hormonal treatments if you have hormone receptors on your tumor. So there are really a lot of treatment options. It's personalized to the patient.
Right. So, essentially maybe they can choose whatever treatment that they can go for with,
Yes.
Discussing it with you, but you mentioned personalized,
Absolutely. Personalized to what's important to them, as well as the details of their cancer.
Now, how can people prevent their risk of breast cancer?
So I would say you can't prevent completely any risk of breast cancer if you're a woman and you're getting older. Those are the two biggest risk factors, being a female and getting older. So that's all of us. You can decrease some risk factors, what we consider modifiable risk factors. So those are being a healthy weight, exercising regularly, no smoking, and alcohol in moderation.
Now, I know y'all offer a lot of support services at the Cancer Center. What are some of those support services offered to breast cancer patients?
We do. So we have a great cancer support group that meets every third Monday. It includes cancer survivors. It includes active cancer patients and their families. We have Beautiful You. So we have a room where we have wigs and hats and scarves that are free to cancer patients, and our employees help try them on and support them through that process. We have Look Good, Feel Better. So that is a program where a licensed cosmetologist does makeovers for free for patients. And just overall coping skills. It's a really big deal if you get a cancer diagnosis. It really makes an impact on your life. So our nurses, our patient navigators, everybody is a part of that team to support the patient through that process.
So lots of services that y'all offer, and fun ones too. I mean, the makeover thing, how fun is that?
Absolutely. Patients really enjoy it.
Right. Now, talk about the importance of mammograms. You know, you hear, get your mammograms. How important is that?
So mammograms are probably what's really changed our treatment of breast cancer and curing more breast cancer. Just early detection itself really allows you to obviously catch the cancer earlier so that you can treat it before it's a later stage and really have a high cure rate based on that. So having a conversation with your doctor about what's the right age to start mammograms based on your risk factors and your family history is something that every woman should do.
Now, I've heard a lot, some patients get diagnosed early with breast cancer. Is there a specific age range for breast cancer diagnosis? Or it just depends?
It's really tough. I mean, I'd certainly say we know that the most common age is in your 50s and 60s. But certainly as you get older, your risk increases. And we do have younger patients that get breast cancer. So the most important thing is really knowing your own breast, paying attention to if there's a change in your breast, presenting to the doctor early, taking into consideration if you have a family history so that you're being more vigilant about screening based on that. So it's really, any woman, period. Again, being a woman, getting older, your biggest risk factors.
And you talk about the importance of mammograms, and self-exams are key too, because early detection is key to, a possible cure.
Absolutely.
Right? Yeah,
absolutely.
Right. Now, I talked about in the intro kind of, breast cancer is common in women, but it can also happen in men, right?
That's absolutely true. For every 100 women, there's one man diagnosed with breast cancer.
Oh, wow.
And when we talk about genetic factors, and the BRCA gene is a common gene that we're aware of that can increase risk of breast cancer, certainly men with a BRCA gene positive in their family would be an example of men that are at much higher risk. So we do see breast cancer in men also.
Now, I know October is Breast Cancer Awareness Month. How have you seen the community giving back to the Cancer Center? I know there's some pink out days. How is that going?
There is. It's going great. I'm always impressed with this community's events in terms of supporting the Cancer Center and supporting breast cancer. And not just that, the uptake in mammograms. So we know that not only is there that enthusiasm to educate the public and get everybody involved in supporting breast cancer, but we see an increase in the number of women coming in for mammograms, so we know it's working. So October is really a great month for that.
Of course. Now, speaking about you personally, did you always know that you wanted to be an oncologist and make a real difference in patients who have been diagnosed with cancer?
Yeah, I would say I didn't have any young experiences with someone with breast cancer or cancer in general.
Right.
But as soon as I encountered cancer patients, I knew immediately that those were the people that I wanted to take care of.
And so how long have you been involved with the Cancer Center here?
I've been at the Cancer Center here since July of 2016.
Oh, well, and you've loved it?
Not too long. I do love it. It has been wonderful.
Yeah, good.
It has been great.
And now, how can people contact you, the Cancer Center, to get a screening or anything, concerning with breast cancer?
Absolutely. I think, do they have some contact information they're going to put up with phone number?
Yes, I believe we do. Yes, they can call Mary Beth Perkins CGMC Cancer Center at 985-876-9045. Or, of course, they can visit the website.
Absolutely.
Yes, okay. All righty. Well, thank you so much, Dr. Genevieve, for joining us. That's all the time we have left for tonight.
Thank you.
Yes, and thank you for all your hard work put into, being an oncologist and dealing with cancer diagnosis of patients.
It's my privilege.
Yes.
Thank you.
And thank you to our viewers for watching this segment with Dr. Genevieve Maronge. Again, if you'd like to make an appointment at Mary Beth Perkins TGMC Cancer Center, call them at 985-876-9045, or of course visit them at tgmc.com. Up next, we have Amber Berry. She is here from Twisted Fitness to talk about yoga and meditation for women of all ages. Stay tuned after this short commercial break.